I guess the turning point came around my year 8 and year 9 when my grandfather fell ill, and he came down with a very severe viral jaundice, and he started to have a liver failure. And at that time, the stigma in India was that if you had liver failure, you must have been an alcoholic. And that affected my family quite deeply because my grandfather was a very religious person. He had never had alcohol in his life, and here he was kind of stigmatized by his own relatives. And in reality, what he had was, unfortunately, he had tuberculosis, and the drugs that he had been given for that left him with a side effect of causing a condition which was not still fully understood or realized at that time. TB is very common, and unfortunately he had that as a flare up during his time, and that affected a lot of us. And I probably reckon that affected me quite significantly in two ways. One was, by that time in my family there had been no doctors at all, and my father was an engineer, and the focus was to get into engineering and read maths and physics and chemistry. And due to my grandfather's illness, I found myself explaining and understanding biology in school better, trying to actually talk to my family and making sense of why my grandfather, who I adored, was now falling ill and didn't look like he'd ever recover, and he died. And his death at that time made me realize actually that I did like medicine, and it's something that made a significant choice in shaping and saying, well, I want to go in for medicine now. And in India, your choices were made when you cleared your sort of year 10 GCSE levels. You had to make and pick a choice of doing biology, and that's what led me to become a doctor, or at least go down the route of studying medicine.